Peace and greetings to you. My name is Omar Abdul-Malik. I am a certified health education specialist and a certified licensed physician assistant. I wanted to make this video for a number of patients and clients who I've seen over the years who have a smoking habit and they've been trying to combat it. I want to first talk about what may constitute a smoking habit. So people who smoke incessantly, talking about chain smokers who've got a pack or maybe even as much as a 2-pack a day history. One of the things that we do in the clinic is determine something called a pack history, is the number of years a person has smoked and multiply that by the number of cigarettes or pack that they smoke. So this is a pack of cigarettes here. I've got it covered, the name covered up, because I don't know what the legalities are for showing name brands on the internet. This is your typical pack of cigarettes. It has 20 cigarettes in it, and this pack, a person may go through this in a day. And this particular brand costs anywhere from $6.50 to about $8, depending on how you get it and where you buy it. So I'm going to go with the average, about $7. So if you have a pack year history, and you smoke every day for a month, I did some math here. So 1 pack a day for 30 days at $7 a pack, that's $210 per month spent on cigarettes over a year. So $210 times 12 months in a year, that's $2,520. Let's call it about $2,500 a month, or a year rather, spent on smoking. For some people, when I've talked to some of my patients and clients, I'll point out the Surgeon General warning. On this particular pack, it says, Surgeon General warning, it says, quitting smoking now greatly reduces serious risks to your health. And I can't tell you the number of patients who have come in demanding that I give them antibiotics because they've got upper respiratory symptoms. They're coughing incessantly, lots of mucus production, feeling tired, can't breathe, difficulty breathing. So it's like they want me to give antibiotics, and I explain to them, first of all, probably what you have is a viral infection, so the antibiotics aren't going to do you any good. Secondly, the best thing you could do to stop experiencing these symptoms is stop smoking. I have here, I cashed a check. One of my checks. This is real money here. This is 25 $100 bills. Now, if I were to take a lighter and set this on fire, you'd say I was crazy. Yeah, but this is what you do. This is what you're doing. And this is new money. I just got this out of the bank. It smells a lot better than this pack of cigarettes. What could you do with this in a year? If you multiply this times 5, so if you have a 5-pack year history, that's $11,000 cash that you've smoked up in 5 years. A 10-pack year history, so meaning that you smoked a pack of cigarettes every day for the past 10 years, $25,000, more than $25,000. So more than 100 times this. What could you do with that money? You could go on a vacation. You could buy a new car. You could make a down payment on a house. You could pay for somebody, if not your own education, maybe your child's education. You could invest it and multiply that money. So if people can't really consider the health benefits of quitting smoking, at least try to consider the financial benefits to quitting smoking. It starts with 1 cigarette a day. I tell people, and again, I got this pack to use as a model. This is your typical cigarette, it's got the filter and then the tobacco in it. If you could, decrease one of these per week, and then make a goal for yourself. Say, okay, at the end of 6 months, I want to go cold turkey. I know there's a lot of, things out there like hypnosis that people can try, and it says, okay, you can quit smoking, within an hour, or within a day. I don't know about any of that. That's not, I wasn't trained in those things, but I have spoken to people who never, they've told me they've tried quitting and then they've gone back. I've written multiple prescriptions for Nicorette gum, the nicotine patch, the nicotine lozenge, until the person, and then there was another pharmaceutical drug called Chantix that worked different from the nicotinic receptor medications. The one thing that all of these medications had in common is that the person had not made a genuine effort to quit smoking. If they hadn't set a realistic goal for themselves to quit smoking, if they were exposed to stressors, like, one guy told me, well, my partner smokes, so I can't quit smoking. Or a woman told me, well, I'm really stressed out at my job, my kids are stressing me out, so I have to smoke. Those are all excuses. And I know, I'm not a smoker, so it's easy for me to stand on this soapbox and say, you just gotta quit. But it's your money. It's your money, It's your cash. And it's going up. It's literally going up in flames. So if you can't think about the health benefits, at least think about the financial benefits. What could you do with all that money? Think about how it could change your life. A lot of us have financial issues. Many of the patients to whom I spoke talked to me about their woes with rent, or mortgage, or utility bills, or child support payments. But they were still smoking a pack a day. They were getting that money to still smoke it up. So try to set a realistic goal for yourself. Say within 1 week, I'm going to decrease my smoking by 1 cigarette a day. Or even if it's 2 weeks. All of the, taking all the patches and the pills and so forth, it's not going to work unless you make a serious commitment and a realistic commitment. And that's all for now. I wish you the best. I wish you good luck. Please share your stories with me. Take care.